Welcome back, dental assistants, to Lecture 15, Periodontics. This is the dental specialty that focuses on the prevention and treatment of periodontal disease. Periodontal disease is a general term used to describe many disorders of the periodontia. Periodontal disease is the most common cause of tooth loss in adults. Factors that contribute to periodontal disease are plaque. It contains acid-producing bacteria that irritates and inflames tissues. Calculus, the mineralized plaque that adheres to the tooth and creates roughness that irritates the periodontium. There is a loss of bone height with the chronic sustained inflammation causing reduction in bone height and tooth support. This reduction in bone height can cause sensitivity to thermal changes and palpation in the tissues. Diabetes is another condition that can cause periodontal disease. It is a metabolic disorder that inhibits healing and increases the effects of inflammation. AIDS is another disease that suppresses the immune system and contributes to the rapid progression of periodontal disease. There are many other disorders that also weaken the immune system and lead to an increased risk of periodontal disease. Now let's discuss some of the signs and symptoms of periodontal disease. That includes bleeding upon brushing, flossing, or upon perioprobing due to the chronic increased inflammation. Discoloration of the gingiva, it becomes reddish or purplish due to that inflammation and poor circulation. There is often gingival swelling due to the inflammation and an enlarged sulcus due to inflammation caused by the increase in pocket depth. There is often a foul odor or chronic bad breath, and there can be loosening of the teeth or even malocclusion. The stages of periodontal disease. First, there is gingivitis that starts to form, which is the inflammation of the gingiva. It can be reversed by utilizing preventative measures. It does not cause bone loss yet and can be caused by plaque accumulation, hormonal changes, or vitamin C deficiencies. Periodontitis is inflammation involving the periodontal ligament and supporting structures. The periodontal pocket is formed when plaque and debris accumulate within the gingival sulcus. Periodontal fibers attaching the tooth cementum to the lamina dura and the tooth socket become diseased. The stages of periodontitis. Early periodontitis occurs when the inflammation progresses to the alveolar bone crest. The pocket depth formation is usually between 3 and 5 millimeters. Moderate periodontitis continues with the destruction of the periodontal structure, and its pocket depth is often somewhere between 5 and 7 millimeters. The furcation, the space between the roots of the multi-rooted teeth, may also begin to occur. Tooth mobility can also become present in this stage. Advanced periodontitis is the increased pocket depths of 8 millimeters or more. This includes the furcation increase and more mobility. Systemic diseases contributing to periodontal disease include diabetes, as we mentioned. Periodontal disease is much more prevalent in diabetics. Symptoms may include the overgrowth of the gingival tissue, bone loss, abscesses, and pain. Epilepsy is another disease that increases periodontitis. A drug called phenytoin or dilantin is a common drug used with epileptics, and 25 to 50% of patients taking this drug experience overgrowth of the gingival tissue or hyperplasia. This overgrowth of the gingival tissues can be treated with prophylaxis to control plaque or surgical removal. Leukemia, a malignancy of the blood cells where the overproduction of white blood cells occurs, can also be another factor. Clinical signs include gingivitis and bleeding of the gingiva. Hemophiliacs, they lack one of the essential clotting factors in their blood. These patients must be diligent with their home dental care without causing abrasion of their soft tissues. Again, AIDS, due to the lack of adequate immune system, they often can suffer the most aggressive periodontal disease. Acute necrotizing ulcerative gingivitis, or ANUG, is a destructive infection of the gingivitis. It's characterized by bad breath, ulcers and necrotic tissue in the mouth, and often just a general feeling of illness. The periodontal exam and the treatment. Radiographs or x-rays help view the height of the alveolar bone. We often use both periapical and bite wing x-rays. A full mouth probing is always done. This probing is on the facial and buccal and includes 3 readings: the mesiofacial, facial, and distofacial. The lingual, which also has 3 readings: mesiolingual, lingual, and distolingual, and all of these probe depths are recorded into the chart. Instrumentation allows for the supragingival and sublingual plaque and calculus to be removed using specific instruments. This is done in prophies, full mouth debridements, and especially scaling and root planing. Some surgical procedures in periodontics includes a gingivectomy, which is the surgical removal of inflamed and diseased tissue. This procedure is performed when a periodontal pocket does not respond to scaling. Gingivoplasty is the removal of excessive tissue and recontouring of the gingiva. Gingival grafting removes tissue from one part of the mouth and places it in another area where the tissue is needed. Osteoplasty is the surgical reshaping of the alveolar bone.